Hello everyone. In this class, we are going to study knowledge on manipulation techniques in orthopedics and traumatology. Manipulation is a treatment method in which the doctor uses the strings of fingers, palms, wrists, and arms, all assisted by devices. The doctor uses various skills based on the clinical symptom to act on tendons, muscles, and bones, as well as make curative effect from surface to interior through meridians and acupoints so as to achieve the effect of reduction, healing, elimination disease, and strengthening the body. Before learning specific manipulation, we should understand its foundation. First, the application principle of manipulation. Before the implementation of manipulation therapy, a detailed clinical examination and necessary auxiliation examination shall be performed to confirm the diagnosis and comprehensively and accurately master the condition, especially for the patients with fracture and dislocation. The doctor should have a stereoscopic image of the local injury in the mind, understand the orientation of the bone and in the limb, that is. In summary, the implementation of traumatic manipulation should follow this principle: timelines, stabilization, accuracy, technique. Timelines. The manipulation should be implemented in an appropriate and timely manner in the early period, so that the patient will feel less pain and heal quickly, with good function recovery. Stabilization. The manipulation should be strong and stable while paying attention to appropriate body position. Accuracy. The doctor should be familiar with and the local anatomy, nature of injury, and displacement direction. During manipulation, the movement should be accurately effective, the force should be appropriate, and unnecessary movements should be avoided. Technique. The doctor should be skillful in manipulation, saving force and ensuring effectiveness. Recklessness and violence should be avoided to prevent any new injuries to the patient. Manipulative therapy should be early, stable, accurate, and skillful without adding new injuries. For patients with fracture and dislocation, effects should be made to achieve successful manipulative reduction in one time. In orthopedics and traumatology disease, such as fracture, dislocation, and tendon soft tissue injuries, manipulative therapy can be used, except in case of indications for surgery. Attention must be paid to its indications and contraindications before the implementation of manipulation, which is particularly important in clinical practice. The effects of manipulation are general as follows. The first, make displaced tissue recover to normal anatomical position. The second, implement manipulation can relieve vascular and muscle spasms, enhance local blood circulation, accelerate the early absorption of blood stasis, and eliminate the swelling and pain of injured limbs. The third, using appropriate manipulation to reduce swelling and resolve mass, unblock stenosis, and strip adhesive so as to recover the joint function. The fourth, relieving the reflective muscle spasms caused by injury pain to achieve the purpose of relieving spasms and stopping pain. Manipulation in orthopedics and traumatology of China have a long history, and China has a vast territory and abundant resources, so there are many schools. According to its role, the manipulation can be divided into two categories: bone setting manipulation and tendon regulation method. Next, we will explain from two aspects: fracture reduction manipulation and dislocation reduction manipulation. First, fracture reduction manipulation. So let's see. Bone setting manipulation plays an important role in the treatment of orthopedics and traumatology of TCM, and is one of the four major treatment methods: reduction, fixation, medicine, and function exercises in orthopedics and traumatology of TCM. It is simple with significant effect and is popular with the vast majority of patients. Here, I will mainly talk about the application of 8 methods of bone set manipulation. First, the precautions for implementing bone setting manipulation. So the first, confirm the diagnosis. Second, pay close attention to the change in systemic conditions. For multiple fracture with weak of chi and blood, hemorrhagic, shock in severe pelvic fracture, and severe traumatic brain injury, reduction shall be suspended temporarily. Temporary fixation or continuous traction can be adopted, and fracture reduction can be considered after the critical condition is improved. The third, grasp the standard of reduction for each fracture. Careful reduction should be performed in an effort to achieve anatomical alignment or close to anatomical alignment. If anatomical alignment cannot be achieved for some fractures, functional alignment should be achieved according to the patient's age, occupation, and fracture size. The fourth, grasping the timing of reduction if allowed by the condition of the body. Reduction shall be performed as early as possible. Within half an hour after fracture, local pain and swelling are mild, muscle spasm has not occurred, and reduction is the easiest. Within 4 to 6 hours after injury, local blood stasis has not coagulated, and reduction is also easy. Generally, manipulation reduction can be considered within 7 to 10 days after injury in adults, but the longer the time, the more difficult reduction is. So the fifth, select appropriate anesthesia, select effect analgesia or anesthesia based on the specific circumstance of patient, and try not to use general anesthesia. The sixth, prepare before reduction. The first is the personal prepare. Determine the attending doctor and the assistant and make a good division of labor. The second, we should to do the equipment preparation. Prepare all necessary items according to the needs of the fracture, such as paper shell, plaster bandage, splint tie, cotton pad, pressure pad, and traction device required. First aid supplies must also be prepared according to the condition to avoid assistance during reduction. The seventh, the staff involved in the reduction should concentrate on it. The eighth, avoid violence. Don't add new injury due to reduction. The ninth, try to reduce successful in one time. Repeated reduction for many times is likely to increase the local soft tissue injury, the swelling will be more serious, and successful reduction will be difficult. It may also lead to delayed fracture healing or joint stiffness. 10. Avoid extreme damage. To reduce the damage of extreme to the patient, reduction and fixation with ice starring into extreme shall be avoided if necessary. If it cannot be avoided, protecting shall be provided to minimize the duration of starving. After reduction, anteposterior and lateral X-ray examination shall be routinely performed to understand the therapeutic effect. Please watch a video on the specific operation and application of 8 methods of bone setting and treatment method for dislocation.
Flexion, extension, contraposition. During the position, one operator holds the proximal end of the joint to fix it, while the other operator holds the distal end of the joint and swings his limb along the chrome axis of the joint to reduce fracture and dislocation.
Touch with your hands and feel with your heart. Hand touch and heart feel through manual touch combined with X-ray images. A three-dimensional image of fraction displacement is contrasted in the brain of the operator. Look, compare, touch, measure. After fracture reduction, the operator compares and observes the changes in lump shape and length, and touches the fracture site to check the effect of reduction. Rotate the loop. The operator holds the distal and proximal fracture ends with both hands respectively. Rotate reversely according to the displacement direction. Set the ends opposite to each other to correct dorsal displacement of oblique fracture. Swelling touch. The operator holds the distal and proximal ends of the fracture respectively, and the distal operator slightly moves up and down, left and right to touch, which is used to check the reduction effect of long shift transverse fracture.
Extension traction contraposition. Extension traction contraposition, mainly used to overcome muscle contraction force, correct overlap, and angular shift. Traction force should be from small to large, sustainable and steady.
Angulation and bending manipulation. The angulation and bending manipulation was used to correct the residual overlapping displacement, and the squeezing manipulation was used to correct residual lateral displacement.
Resetting lifting manipulation. Resetting manipulation is used to correct forward and backward or up and down movements. The operator presses down the protruding fracture end with his thumbs, and the other 4 points to the other end of the upper fracture for reduction. Lifting manipulation. Under traction. Squeeze the displaced 2 fracture ends with 2 thumbs respectively to correct the left and right lateral displacement.
Bond separation by pitching squeezing manipulation. The thumb, index, middle, ring finger of both hands was placed on the dorsal side of the fracture. The bond gap is squeezed oppositely, and the bond is divided at the same time so that the fracture ends are separated.
Okay, the above contents are all the contents of manipulation. I hope that you can practice more after class and master the specific operation of each manipulation and related indications. Thank you very much. See you next time.